Welcome back to Africa 54. Now, what are your blood pressure numbers? If you don't know, Africa 54's Linord Moudou is here to tell us why you should find out. Welcome, Linord.
Hello, Vincent, and that's right, you should find out. Well, World Health Day was this past Sunday, April 7th, with an emphasis on detecting and treating high blood pressure. It is a problem afflicting an increasing number of people in Kenya, as the country enjoys a rapid economic development, while a growing middle class is consuming more processed foods while exercising less, putting themselves at risk for hypertension. Professor Elijah Ogola, a cardiologist who teaches at the University of Nairobi, elaborates on the issue.
But the drivers of high blood pressure generally are what we're seeing, and it relates to salt intake in food. It relates to decrease in physical activity, it relates to increase in weight, it relates to stress, and all over the world these tend to be associated with one, urbanization, and two, the so-called Western lifestyle. So the bottom line is, yes, hypertension prevalence has increased remarkably.
Experts say some steps to reducing the risks of high blood pressure include a reduction on salt intake, eating a balanced diet, avoiding harmful use of alcohol, walking and exercising regularly, and avoiding tobacco use. And if you have been to the doctor lately, you may have had a blood pressure test as a part of your routine appointment or as a screening for high blood pressure hypertension. Well, joining us in the studio to tell us more on the test is registered nurse Adeola Akindana. She's a member of the board of directors of the American Association of Diabetes Educators and founder and executive director of Health Beam Outreach. Mrs. Akindana, welcome to the show.
Thank you very much.
First of all, how often should we take our blood pressure?
Well, for normal patients without diabetes, when you go for your doctor's appointment, they should check your blood pressure regularly. If you've been told that you have high blood pressure, then you might want to get a home equipment to monitor your blood pressure at home if the doctor placed you on some medication, just to see how it's working. And
if you have been told that you have high blood pressure, how often? Is it a daily, something that you should do daily?
Well, not necessarily for everybody. It depends. Okay. If a person has severe hypertension, or if they're not responding to medications, then the doctor might want them to check on a regular basis just to kind of find out what the pattern is to aid in terms of therapy.
And you have with, today, you brought an equipment here, which is something that is being used, a blood pressure monitor. Yeah. So is it something like that someone can purchase and have it at home?
That's correct. This is a digital blood pressure monitor that anybody could get from a drugstore, and they could use at home for checking their blood pressure. And monitoring is also important, that they write down those numbers so that when they go for their next visit, they can share that information with their provider.
Okay, let's do something. Can you take my blood pressure?
Oh, most certainly.
I hope it's good. I was busy running around this morning, but I need to, what arm first of all?
We could do either one.
Okay.
You know, it's usually recommended to do the left arm, and sometimes you might have to do both. But
okay, let's do this
But we'll
arm.
do the right, since it's next to me.
So
most important is you have to make sure that you get the right cuff. So there are different sizes. So depending on how large the arm is, you have to make sure you get the right cuff. You could just put this down for me.
All right. I've done this many times.
Many times?
As a doctor. Every time you go to the doctor, this is one of the first things they do. So what exactly are we looking for?
So normally if you're going to check your blood pressure, it's important, just like you said, you've been running around, to sit down for at least about 5 minutes quietly before you check your blood pressure.
Okay.
Once you apply the arm, you then start the machine.
Start the machine, and you can feel the pressure.
So you need to be quiet right now.
Okay.
And like you said, you could feel the pressure. So it's monitoring both your systolic blood pressure and your diastolic blood pressure.
What does it mean?
Well, the systolic blood pressure tells us about your heart squeezing, and then the diastolic pressure tells us about your heart relaxing. So because the heart is like a pump, and you don't want it to work too hard. So really that's what the blood pressure is monitoring, how hard is your heart pumping.
Okay, how am I doing?
Well,
it's not good, huh?
Yours is a little bit on the high side.
Yes.
So again, it might be from the excitement and running around.
Exactly. And maybe
obviously,
Vincent McCurry earlier maybe did something to me and
very,
it went up.
very probable. But that's something like you, and if you get a number like yours, you have to check it again. So just checking once doesn't mean that you have hypertension. So you might want to check a couple of times, because sometimes anxiety also makes your blood pressure increase, activity makes it increase, and things like that. Okay. And if it's still high, then you want to share with your provider.
All right, so while this is good to know, and I will make sure I check it again, and cut down on the salt, definitely exercise more, and this is what experts say can help with blood pressure. Thank you so much, Mrs. Akindana, for joining us today.
Thank you for having me.
And that's our Africa Health Network for today. For more health news and developments, be sure to visit our website, africahealthnetwork.com.